Hello and welcome to Pregnancy Info. Today we are discussing the placental abruption, its causes and symptoms. But what is a placental abruption? Placental abruption is a pregnancy complication that happens when the placenta separates from your uterus before delivery. The placenta is a temporary organ that connects a growing fetus to your uterus during pregnancy. It attaches to the wall of your uterus, usually on the top or side, and acts as a lifeline that gives nutrients and oxygen to the fetus through the umbilical cord. The placenta also removes wastes from the fetus blood. In placental abruption, the placenta may completely or partially detach. This can decrease the amount of oxygen and nutrients the fetus gets, can cause heavy bleeding in the birthing parent. Your healthcare provider will need to monitor you closely and determine if an early delivery is necessary. What are the different types of placental abruption? Your healthcare provider will classify the abruption based on how much the placenta detaches from your uterus. A partial placental abruption occurs when the placenta doesn't completely detach from the uterine wall. A complete or total placental abruption occurs when the placenta completely detaches from the uterine wall. There is usually more vaginal bleeding with a complete abruption. They will further classify it by how much you are bleeding. Revealed placental abruption have moderate to severe vaginal bleeding that you can see. Concealed placental abruption have little or no visible vaginal bleeding. Blood is trapped between the placenta and uterine wall. Now, question is that how common is a placental abruption? Placental abruption occurs in about 1 out of 100 pregnancies. It means it will be 1% only, but it happens. And it's a serious condition. What week is placental abruption most common? Placental abruption most commonly occur later in the third trimester, which begins around 28 weeks of pregnancy and lasts until delivery, but it can occur any time after 20 weeks. Symptoms and causes. What are the symptoms of placental abruption? Each person can have different symptoms of placental abruption, but the most common symptom is vaginal bleeding with cramping during the third trimester of pregnancy. Other symptoms include abdominal pain, uterine contraction that are longer and more intense than typical labor contraction, uterine tenderness, backache or back pain, feeling the fetus move less. Vaginal bleeding can vary and isn't an indication of how severe the abruption is. What are the first signs of a placental abruption? The most common symptom of a placental abruption is vaginal bleeding. Although you won't always bleed, you may also have sudden ongoing pain in your abdomen, belly or back. What does placental abruption feel like? You may experience sudden or sharp pain, cramping or tenderness in your lower pelvic region or back during a placental abruption. You could also feel the fetus move less. Discuss these symptoms with your pregnancy care provider immediately. Do you always bleed during a placental abruption? Most of the time, you see some blood during a placental abruption, but if the abruption is concealed, the blood will be trapped between the placenta. In that cases, there will be no bleeding. In other cases, the abruption develops slowly, which can cause occasional light bleeding. What causes placental abruption? The cause of placental abruption is often unknown. Healthcare provider mean what increases your risk for an abruption. For example, abdominal trauma such as from a fall or accident can increase your risk for placental abruption. Can pushing on your belly cause placental abruption? Pushing on your belly, like when your provider presses on the belly at your prenatal appointments, doesn't cause a placental abruption. But a blow to your belly, such as in a car accident or falling down the steps, can cause the placenta to detach. Can a bumpy ride in a car cause placental abruption? No, a bumpy ride in a vehicle, bus or airplane isn't one of the causes of placental abruption, but your provider will ask that you avoid any activities that have a high risk of falling or abdominal trauma. This could include things like riding horses or roller coasters. Risk factors for placental abruption. The factors increase your risk of placental abruption are that trauma or injury in your uterus, like a car accident, fall or blow to the stomach, previous placental abruption, multiple gestations like more than one fetus, high blood pressure, hypertension, gestational diabetes or preeclampsia. If you smoke or use recreational drug, being older than 40, uterine fibroids, thrombophilia, a blood clotting disorder, premature rupture of membranes, your water breaks before the fetus is full term or losing too much amniotic fluid, chorioamnionitis, an infection in your amniotic fluid. What are the complications of placental abruption? Placental abruption can be life-threatening to the fetus and sometimes to you. Complications from a placental abruption include for the fetus premature birth, low birth weight, growth problems, brain injury from lack of oxygen, stillbirth, for the birthing parent, anemia, blood clotting issues, blood transfusion, hemorrhage, kidney failure. Diagnosis. How is a placental abruption diagnosed? Your healthcare provider will diagnose placental abruption with an exam and other tests. You may be admitted to the hospital depending on the severity of the abruption, or you may be able to rest at home. Your healthcare provider will ask how much bleeding has occurred. Ask where you feel pain and how intense the pain is. Ask when symptoms started. Monitor your blood pressure, monitor your contractions, monitor the fetal heart rate and movement. Use ultrasound to locate the bleeding and to check the fetus. Recommend urine or blood test. There are typically 3 degrees or classes of placental abruption a healthcare provider will diagnose. Grade 1. Small amount of bleeding, some uterine contractions and no sign of stress to you for years. Or the fetus. This is usually a mild or partial placental abruption, meaning only part of the placenta is detached. Grade 2. Mild to moderate amount of bleeding, some uterine contractions and possible signs of fetal distress. Grade 3. Moderate to severe bleeding or concealed bleeding, uterine contractions that don't relax, abdominal pain, low blood pressure and potential fetal death. Treatment. How is a placental abruption treated? Once the placenta has separated from the uterus, it can be reconnected or repaired. A healthcare provider will recommend treatment based on the severity of the abruption, how long the pregnancy is, gestational age of the fetus, signs of distress from the fetus, amount of blood you have lost. Prevention. Can I prevent a placental abruption? You can't typically prevent a placental abruption, but you can reduce your risk by not smoking or using recreational drugs. Talk to your provider before taking any medicine during pregnancy. Keeping your blood pressure at a healthy level, managing chronic health conditions, taking health and safety precautions like wearing a seatbelt, reporting any abdominal trauma or vaginal bleeding to your healthcare provider. So this is all about the placental abruption, its causes, sign, diagnosis and treatment. Share this video with friends and the girls who are facing this problem, and must share your opinion. How do you find this video in the comment section? Thank you.